So another term which is closely related with the swallowing is presbyphagia. As the percentage of older generation or the proportion of older people are increasing in population, this is becoming a difficult to treat task. That is the changes in swallowing in relation to aging. That is called presbyphagia. So in old age, there are so many derangements in the system, body system, and the important one in relation to swallowing one is nervous system changes. There is a total neural degeneration happens. So the neural control of swallowing is not working properly. So, and also there are skeletal changes, especially the epiglottis and then arytenoid, etc., and the cartilages involved in swallowing, they get ossified, so they are not as flexible as in younger age. So the mechanism of falling backward of the epiglottis is not happening properly. The approximation of arytenoids are not happening properly, so there is chance of aspiration. Along with that, there is also the old age can have cervical spondylitis. Again, that will cause changes, or the working capacity of the cervical esophagus is diminished because of that. Then there are muscle changes which happen. The tension of and the tone of the muscles will be reduced. The reflex action of the muscles will be reduced. So again there are problems with that, and also the lowering of the respiratory function with the old age. So because of that, now we know the different stages of swallowing. So in the first stage, which is the oral phase, all these happen because there is reduced cognitive function, because there is reduced number of teeth, the chewing is not happening properly, reduced muscle strength is there, especially the first stage there should be approximation of the lips. So in old age what happens is orbicularis oris is not working properly, so the patient will not close the mouth while swallowing or chewing, so that there is food will flow through the side of the lips during swallowing phase. Then reduced taste and olfaction, then altered salivary secretion, so the mechanism of food bolus formation is not working properly. All these can happen in the oral phase, and also in the propulsive phase, this approximation with the soft palate or the palatoglossal arch may not move properly, the tone of the muscles will be reduced, so again there is chance of regurgitation. So in the pharyngeal phase also, there are all the steps of pharyngeal phase can be altered. One is there is altered functioning or the coordination between swallowing and respiration. Then this anterior displacement or elongation or upward movement of the hyoid and other cartilages will not happen. And also I already told you, because of the skeletal changes, this protective movement of the epiglottis, adduction of the glottis, adduction or the approximation of the arytenoids will not happen. So again there is chance of aspiration in all these cases. And also the upper esophageal sphincter may not be working properly, so there is also difficulty at the end of pharyngeal stage. Esophageal stage also, because this upper esophageal sphincter, the tone will be reduced, and also the peristaltic movement will not be in a coordinated way, and because of anxiety, I already told you there is a tertiary peristaltic wave. They are more prominent in old age than in younger people. So because of all these, all the three phases of swallowing will be problematic, and also there will be difficulty in closing the mouth, then the flow of food through the corner of mouth, then nasal regurgitation, aspiration, cough, swallowing, difficulty in swallowing, all these will happen. So what can we do? The treatment of presbyphagia is basically rehabilitation. There is no drugs or surgery to improve the condition. So rehabilitation can be rehabilitation education and rehabilitation therapy. Educate the patient on postural adjustment, that is ask them to swallow forcefully and also swallow in a downward direction of the lower jaw. So that the aspiration chance of aspiration is reduced. Then adjust the eating strategy. What is that? That is to eat slowly, avoid seeing TV while swallowing, avoid talking while swallowing, avoid eating in a hurry, and don't swallow too much of food in a bite, and to avoid mixing too much of different consistency, that is too much of food with liquid like that. Actually, a single consistency food will enable the swallowing much easier. The use of assistive devices like those used for placing, guiding and controlling food while swallowing can be used in order to prevent aspiration, and frequent oral care will reduce problem with the teeth and also aspiration. And in rehabilitation therapy measures, one is isometric resistance training of buccal surface, then lips, tongue and the oropharyngeal and the laryngopharyngeal musculature for 8 weeks significantly improved the function. And eye stimulation of these muscles, especially of the oral mucosa, will increase the sensitivity to food. And thirdly, respiratory training will improve the muscles and reduce the chances of aspiration. And also, in order to, I'll write here, in order to increase the tone of upper esophageal sphincter, there is a therapy called simple shaker therapy. Okay. It will significantly improve the tone of upper as well as the lower esophageal sphincter. So all these can be used in the treatment strategies of presbyphagia. So you should be aware of this term, and the problems in old age should not be overlooked. Thank you.